want to now go to our Chief Medical Officer of the Ohio Department of Health, Dr. Bruce Vanderhoff. Doctor, thank you for joining us. You're officially on the team, and so thank you very, very much for this, the good work that you're doing. I know that you and I have talked an awful lot. We talked some before you took the position, but we've been talking a lot more since you took this position. So give us a little perspective from a medical, scientific point of view about what we're seeing in Ohio right now, and maybe some of the things that we should be looking to do and what the significance of all this is.
Well, thank you, Governor DeWine. I'd like to share information about really two things: the science of COVID-19 and how our hospitals are handling all of this. First, let's turn to the science. At the beginning of March, when COVID-19 first arrived in Ohio, we didn't know much about the virus and the disease it causes. This science has evolved as the virus has spread across the world, and today, our picture of how the disease progresses is much more complete. What we know is that this disease is spread mostly through the air by respiratory droplets. When we cough, sneeze, sing, talk, even when we breathe, we expel virus droplets into the air. If an infected person is having a conversation in close proximity to another person, or coughs, or sneezes next to them, we know now that that second person is at real risk of being infected by some of these airborne droplets. Fortunately, what we know today is that there really are simple things each and every one of us can do to protect ourselves from these droplets. We can maintain a good distance, say 6 feet, from those around us, and we can wear a mask. These are simple and yet very effective non-pharmaceutical interventions that accomplish three things. They protect the person you're interacting with because the mask limits your respiratory droplet spray, and keeping your distance makes it harder to share the virus. Today, we also know that the masks protect the wearer from being on the receiving end of another person's respiratory droplets. And there's now scientific evidence that if you're wearing a mask and yet still are infected, you're less likely to get sick than if you weren't wearing a mask. I also want to comment on the importance of good ventilation. As we shift to being more and more inside, we need to look for ways to ensure good ventilation when we're around others. So if you're going to be inside around people who aren't in your inner circle, consider cracking a window in addition to wearing a mask. The science is absolutely clear. Keeping your distance, wearing a mask, and good ventilation all work together to form a protective barrier against viral transmission. It doesn't matter if you feel fine or you just have a mild tickle in your throat. You could be asymptomatic and still a carrier, able to infect the people around you, even if you feel absolutely fine. That's why it's crucial that each one of us wears a mask when we're around anyone who isn't in our immediate circle. Now, as the holidays approach, these protective measures are going to be even more important. It's obviously not possible to wear a mask while you're eating or you're drinking, which is why we're recommending that you celebrate small this season. Keeping your celebrations to the inner circle of people who live in your household will help protect you and your family. Now I'd like to turn to our hospitals. Something that's important for us to know as we think about and talk about COVID-19 is the trajectory of this disease and how long it may take for someone to get sick enough to end up in the hospital. Say, for example, I was infected with COVID-19 on Monday. It could take 3 days for the virus to make me sick enough to start showing symptoms. Then it could take me another couple days of feeling lousy before I decided to go to the doctor. Assuming I got tested and the doctor gave me a result, and that result came back, let's say, fairly quickly in 48 hours, it could take another couple of days of feeling badly before I got sick enough to say, you know, I need to go to the hospital. Once people get admitted to the hospital, we need to be aware that they aren't staying a short period of time. We've made great strides in the treatment of COVID-19, and those advancements have, in fact, reduced hospital stays a lot. Nevertheless, even with these improvements, a person who gets admitted to the hospital for COVID-19 typically will stay several days. And if you're sick enough to end up in the ICU, especially on a ventilator, your length of stay could be weeks. Now, if you've never seen anyone who needs a ventilator for assistance with breathing, you should know that it's not an easy road. It can take a long time to rebound from being on a vent. It's grueling and requires a long recovery even after you're breathing on your own again. I speak directly with my colleagues in healthcare around the state each and every day. And what they're telling me is that the situation is very serious. As we look around the state, every county is being impacted. There's no relief valve. There's no place where the virus isn't transmitting at a high rate. A month ago, we had 1,000 people in the hospital at any given time. Today, that number is more than 3,600, and it's growing considerably. In the spring, we focused our efforts on conserving PPE and building physical capacity, the space and the stuff for our healthcare system. We were successful, and we're in much better position today to help support our hospitals through this surge. However, we now face a different kind of crisis. It's the people. It's a staffing crisis. Our caregivers are in a precarious situation. They're at risk of illness because of their exposure or their family's exposure outside the hospital. As a result of these outside the hospital exposures, some of those people, some of those vital nurses and other medical staff may be quarantined or may become ill themselves. Many of them have been treating COVID-19 patients since March, and they're just exhausted. Let me leave you with this thought. We all need to do absolutely everything we can to contain the spread of this virus. We're at a critical juncture. We need to protect our healthcare workers. I spoke earlier about the trajectory of the disease. Remember that even if we make necessary changes immediately, it's going to take us weeks before we start seeing any real improvement in those hospital numbers. Even if you don't believe in masks, please wear one. Keep your distance from other people and reconsider your gatherings to protect our healthcare workers. They really need us now more than ever.
Doctor, thank you very much. Thanks for being with us. Great to have you on the team. Department of Mental Health and Addiction Services Director Lori Criss is next, and we're going to Skype her in. And Lori, you've talked to me a lot about what we're seeing out there with people and their mental health needs. I know that as I've talked to other people across the state, we're seeing that as well. Maybe you can help us a little bit about how to get through this and maybe help family and friends get through it.
Yeah, thank you so much, Governor, for having me back. I appreciate your attention to our physical health and our mental health as Ohioans, and I know that so many others do as well. This pandemic is definitely creating prolonged stress for all of us, and if you're feeling stressed out, you're not alone. It's okay to not be okay, and it's okay to ask for help. And these are things that you've heard me say before, you've heard the governor talk about before, and it's true. We've established an Ohio Care Line so that if you want to talk to someone about your stress, you can call 1-800-720-9616 to connect with a health professional 24 hours a day. And maybe you don't want to have a conversation. You'd rather just text with someone. That's available too. You can text the number 4 and the word HOPE to 741-741, and you can chat via text. Either way, you're connected to a mental health professional that's just going to walk you through answering questions that you have, listening to your concerns, connecting you to resources or information in your local community. Maybe you don't really need to talk to someone yet, but there are still healthy ways for each of us to think about adapting to adversity during the pandemic. And these are pretty simple things that each of us can do, but they do take some attention on our part to make sure that we're taking care of ourselves. So the governor's already talked about this, staying emotionally connected to people that we care about each day, reaching out to a friend or a family member with a phone call. It helps us feel better as the person making call, and it's always great to get a phone call from a friend too. Get a little bit of fresh air, a little bit of sunlight, a little bit of exercise each day. That gets a little harder in the colder months in Ohio, especially the sunlight sometimes, but getting outside, and even if it's just bundling up and taking a walk around the block or doing some stretches inside near a window, these are good things for us physically. And then the other thing I'll just mention quickly today is prioritizing time for your spirituality or your faith. Spending some time in meditation or prayer is something that can really help with managing stress too. So again, these things sound simple, and it's easy to move away from any one or all of these things on a day-to-day basis, especially if we're dealing with financial struggles or missing loved ones during the holidays or supporting a school-age child during the learning from home. But research shows that these coping strategies will help each of us deal with adversity, and they help each of us build some confidence in our skills, calmness in our mind, and perseverance when we're starting to feel the fatigue of the pandemic and it taking place over months and months. So remember, taking care of yourself is a priority, not a luxury. And now I just want to take a minute to talk to our friends and family and neighbors who have been struggling with or recovering from a mental illness or a substance use disorder, maybe starting before the pandemic. Please keep up with your treatment, keep up with your medication, stay connected to your support groups. If you run a facility that hosts a support meeting, find ways for that meeting to continue in person in a safe way if possible. And if not, look for ways for people to connect virtually through social media meetings or other connections. These support meetings are life-saving, so stay connected to your peers. They'll help you when times get tough. Also, we know that no matter how long someone's been in recovery from a mental illness or a substance use disorder, relapse can happen under prolonged stress. And so the pandemic is certainly something that can threaten relapse for our friends and family who are in recovery. Let's make sure that none of us are making assumptions, that we're checking in with our friends, checking in with our families who we know have struggled with addiction or mental illness in the past. Invite these family members, these friends into our inner circle, into our bubble, to help them find ways to be safe and help support their wellness from COVID-19, but also to reduce opportunities from being alone and for having a substance use crisis without support, and that could include an overdose. Ask your friends and family who are in recovery if they're okay. Encourage them to stay connected to treatment and support. Ask if they need help getting what they need. And if they do, then there's resources available. You can go to takechargeohio.org, or you can again call the Ohio Care Line at 1-800-720-9616. These are simple ways that each of us can commit to supporting ourselves and one another every day during the pandemic and beyond. And remember, taking care of yourself is a priority, not a luxury.
Well, Director, thank you very much. All good comments, very important comments. For example, if someone is in an AA group, what you're saying is try to figure out either how to physically continue that, maybe wear masks, do something, or do it online, or somehow keep that connection. Is that?
That's right. That's right. There are a lot of peer support groups, family support groups that are continuing in person. Maybe there's fewer people, they're sitting further apart, they're wearing masks, the meetings might be shorter. So don't assume that a meeting's not happening, reach out and find out. But also online, there are a number of meetings available, and there are organizations that are hosting those, and they're private and confidential and secure as well.
Great. Well, thank you very much. Thanks for the great work you do and your team and the folks around the state of Ohio. So we appreciate that very, very much. Before we go to the Lieutenant Governor, maybe just a couple more comments about the curfew, because I'm sure people are saying, well, what all does that mean? Again, 10 o'clock to 5 o'clock in the morning. Basically want people not to be out, but there certainly is always exceptions. It would not apply to those who need to go to work during those hours, or those who need to be out for any kind of emergency purpose. Curfew is not intended to stop anyone from getting groceries or getting a meal from carryout or drive-through or delivery. Curfew is not intended to stop anyone from going to a hospital, obviously, or seeing a doctor or getting help or treatment for medical or mental health conditions. So just kind of common sense. Our idea is to kind of carve this time out, and we know that if we all do it, with some exceptions, that in and of itself will reduce some of these contacts that are going on. So, Lieutenant Governor, we'll turn it over to you.
Thanks very much, Governor. Last part, people need to pay attention to that. It's just common sense. And Lori and Bruce are great. A lot of great advice there. And, you know, I've had lots of conversations over the last week from people who offered opinions and advice. And I've just tried to put it in perspective for them. We've heard a lot of statistics. It's always hard to know which ones to use, but it took us 5 months to get to our first 100,000 cases. And we had 100,000 cases of virus spread over the last 3 weeks. That puts in perspective about what we're confronting now. And I know the governor and Bruce alluded to this, but over the past 21 days, hospitals, as a result of that spread, have seen the increase from around 1,400 patients to over 3,600. And as a result, some of those hospitals have had to accommodate this increasing numbers by slowing, postponing some elective surgeries. And we just can't see this trend continue without it having a really increasingly negative impact on the way that our caregivers provide that care. And so doing nothing is not an option. It's easy to understand why, though, because I've had a lot of these conversations. It's easy to understand why targeted shutdowns of businesses like restaurants and fitness centers were for some considered pretty unpopular. And they didn't consider it a fair solution because those businesses and the people who rely on those paychecks would bear a disproportionate responsibility of the burden, when we all know this, that the responsibility for the solution lies with all of us. Personal responsibility and accountability and shared responsibility. We don't need a shutdown, but we do need to slow down for a few weeks to get this virus back into a manageable situation. I often hear people asking for this balanced approach as the best approach. And our challenge now is, how do we reduce the spread of the virus, not overwhelm our hospitals, keep businesses open, save jobs, educate kids, avoid the unintended consequences, anxiety and stress, and mental health issues, addiction and abuse, those things that Lori, Criss talked about that can wear on us. This is the complexity of the problem that we're trying to resolve. And of all of the options we discussed with business leaders, healthcare community leaders, legislators, school leaders, a 21-day temporary curfew was considered the least disruptive option to our economy, but also believed to have a meaningfully positive impact for our healthcare providers. That's the balance. And the majority of the opinions of the people we talked to felt the approach the governor outlined today would be the best way to go. The virus spreads when people get together. So for a while, we need to make sure that fewer people are coming together and spreading the virus. No shutdowns, just a slowdown. This has been hard on everyone. I've talked to sons and daughters who've lost parents to COVID, overwhelmed nurses who care for COVID patients and don't want to carry the virus back home to their families. I've talked to business owners who've closed and even more who are struggling, and employees who've lost their jobs and those who are anxious, fearful that they might lose theirs, and moms who are stressed over educating their kids at the same time they're trying to work from home. I know it has been hard and it is hard, but we need to get the spread of this virus under control, and we can do that. And we'll get through this. We just do what the governor's asking us to do. We're going to get through this to that vaccine. That's the light. There's some great news, as the governor mentioned, about some quality vaccine options that are on the way. We just got to get through this tough part. You know, I know it affects every family, and every family needs to have a plan. And I shared with the governor this morning about what our family plan is. On Sunday, my dad called. He and my mom are in their 80s. And I know the highlight of their year is Thanksgiving, because it's the only time of the year where all of their kids and their grandchildren are ever together. And I knew when I picked up the phone, answered my dad's call, he was concerned, didn't know how to do it safely. So we talked about it. We made a family plan. Our families are all going to limit our exposure between now and Thanksgiving. We decided that we would have Thanksgiving outside this year. Now I know that can be weather dependent, so we're going to be flexible. Maybe it'll be the day before Thanksgiving. It might be on Thanksgiving. It might be the day after Thanksgiving, based on whether the weather will allow us to, will cooperate and allow us to do that. And we're going to space everybody out, have every family sit at their individual table in our normal family group, but we're all going to be together, just a little farther apart than usual. And we know that this will dramatically reduce the chance that my mom and dad will get the virus or be exposed to the virus. And no, it won't be a Thanksgiving as usual, but with the right attitude, it will be a great Thanksgiving. And if we do it right, if we all do it right, that will make sure that my mom and dad get to be around for their next Thanksgiving. It will be inconvenient, but we'll get through it. We'll all get through this. Everybody has to have that family plan. And sometimes we have to have those difficult conversations, like I've had to have with my own family about how we do this. And I want to say thank you. Thank you for all of you who will make sacrifices, have been making them, and will be making them as families over this holiday season and during the next 21 days. But we're going to get through it. We just got to stick together. With that, I'm going to introduce somebody that I've been sticking together with, at least on the phone, for an hour a week since April, and that's John Barker. He represents the Ohio Restaurant Association. We have been in regular conversations with them about how to keep those very difficult to operate businesses during a pandemic open and safe. And maybe over Thanksgiving, just as a thought, you can order out from one of his restaurant members that will help you keep things safe for you and your family as you're trying to celebrate the season. So let me introduce John Barker, and he's going to really, I think, reflect what the conversations have been with the business community about how we find that balance between the needs of our healthcare community and the needs of businesses and the economy. So John, let me turn it over to you.
Thanks, Lieutenant Governor. Our restaurants appreciate the plug, for some pickup Thanksgiving dinners. That'll help everybody. Also, thank you, Governor, for all the time that both you and Lieutenant Governor have given to the business community and to the ORA. I'm really happy to be here today. I represent the Ohio Restaurant Association, but our board of directors were in support of your announcement today about the 21-day curfew. And, we're all committed. We're going to do our part, help control the spread of COVID-19. We know there's tremendous pressure on the medical system and healthcare workers. It is severe. We know that. And all Ohioans now have the chance to kind of step up a little bit more, help curb the spread and lower the number of patients that are in our hospitals and the ICU units. We know those are real numbers, and we know we're all very concerned about that. You know, I have two daughters in the healthcare field. My oldest is a physician assistant here in Columbus, and the other is a registered nurse in Iowa. They talk to me all the time about what they see firsthand. And this virus, getting it down in Ohio and getting it down across the United States is part of all of our jobs as citizens. So we appreciate everybody being so focused on this. And we really appreciate your decision as well as this announcement today. We think it's the right step at the right time. It's going to allow Ohioans to do their part without having what we thought would be an immediate and disastrous impact on restaurants and thousands of employees if we shut everything down. The vast majority of restaurants and hospitality locations in Ohio, they are operating safely. We know that. They care so much about their employees. They actually refer to them as their family. And we know that we also love taking care of our guests. So we certainly want to be safe. You know, months ago, we started something called the Ohio Restaurant Promise. And that's where operators pledge to meet and exceed the Dine Safe Ohio requirements. You know, and we've seen incredible examples all over the state. Restaurants, they're separating their tables. They're doing that 6-foot distancing. They're placing barriers between tables and booths. They're doing more extensive cleaning and sanitizing. And it was already something that was critical to our industry. You know, they make sure that their employees are wearing their mask and the guests are wearing masks until they sit down to eat. And I even saw over the last couple of weeks the installation of new air filtration, updated air filtration systems and units in restaurants all over the place. It's just a great thing that we're seeing. We're really proud of the work that's being done by restaurants, food service locations, and many bars. You know, even though many of them are facing sales that have been down between 20 and 70% versus the same time a year ago. And any of you that are in business know how difficult it is to operate that way. At the same time, they have all these PPE costs that are very significant. You know, I think it's important to recognize that restaurants have done everything to ensure that they're not spreading the virus. And the good news is that medical experts confirm it's true. The spread appears to be occurring in unregulated settings, like we've talked about, home parties, family gatherings, social events, some schools and other places where individuals are not always following the advice and wearing masks, as our doctor talked about. We believe the curfew is the best choice to slow things down right now and help everybody understand it's time to be even more cautious. I think it's a good decision. Most restaurants, especially independent and family-owned ones, can't survive the pandemic without all of us doing our part to control this virus. You know, many restaurants and small businesses all over Ohio were able to take part of the Paycheck Protection Program, which was a lifeline. That was funding that we got a few months ago, but that money's gone. Now, more recently, Governor, you and Lieutenant Governor provided several forms of financial support, including the BWC refund, and we're so thankful for that. Those are all steps to help businesses get through this and employees. However, we all know it's not enough. You know, restaurants and food service and retail businesses, they need to remain open. You know, we're providing food to guests at restaurants, but you know that we're really stepping up and doing more and more carryout and pickup window and delivery. And this is going to help ensure that as many of those 585,000 people who call our industry their home, that's where they work, keep their jobs. You know, we're really also thankful for our ability to continue offering takeout and delivery past 10 o'clock. You know, we feed Ohioans and we take care of thousands of essential employees who work those second and third shifts, as well as everybody on the front line who's working 24 hours a day. You know, we take this responsibility seriously, and we pledge to continue operating safely and continue to work with you. Thank you.
John, thank you very, very much. Appreciate it. A number of your members have contacted me about what they're doing with their air filtration, and some very, very, really following the science on that, and that's very important. We appreciate that very much. Thank you. Thanks for being with us.